A blister on your heel. Night falls and you're still miles from camp. You limp into a clearing, a raw patch of skin exposed under a torn sock. This is what keeps you alive, knowing how to treat that blister before it worsens and forces you to stop. Locate a clean, dry area to sit, peel off your wet sock, and clean the affected area gently with water if you have it. Apply a barrier ointment if you have any and cover the blister with a sterile bandage or clean cloth. Avoid popping the blister as this can lead to infection. Keep the area dry and change your bandage regularly. Remember, treating injuries effectively can mean the difference between continuing your journey safely and having to stop. You need just 3 things: a clean, sharp knife, a small piece of sterile gauze, and some moleskin or medical tape. Keep these in your first aid kit. No excuses. Remember, if a blister breaks, clean it thoroughly to prevent infection and cover it with a sterile dressing before using moleskin or tape to cushion and protect the area. Always prioritize proper foot care to avoid blisters in the first place by ensuring your shoes fit well and you wear moisture-wicking socks. First, stop walking. Sit down, rest your feet. Listen to this warning to prevent further injury. Ignoring the warning can lead to larger blisters, torn skin, and a risk of infection, potentially ending your walk. Address the issue now to finish your walk pain-free and safely. Step 1. Clean the blister. Take the knife and sterilize it with alcohol. Then gently wash the blister with clean, potable water. If you have soap, use a small amount, but be careful not to irritate the skin. Mistakes here are simple. Being too rough or using unclean water can introduce infection. If you can't wash with water, use a clean, sterilized cloth dampened with alcohol. Step 2. Drain the blister carefully. Use a sterilized needle or pin to make a tiny hole about the size of your pinhead. This allows fluid to escape without breaking the skin. If you make the hole too large, you risk infection and further irritation. Be precise and gentle. Remember, the goal is to release fluid, not damage tissue. Always sterilize your tools and keep the area clean to prevent infection. Step 3. Drain the blister. Gently press around the edges to release the fluid, but avoid squeezing hard or twisting, as this can tear the skin and expose raw, vulnerable flesh. If the blister doesn't drain easily, leave it and try again later when it's softer. Patience is key, and always handle blisters with care to prevent infection. Step 4. Cover the blister. Place a piece of clean, dry gauze over it. Secure it with tape or moleskin. If using tape, cover the blister with a bandage to protect it. If using moleskin, cut it to fit the blister and stick it directly on top. Common mistakes include using dirty gauze or not securing it well, which can cause further irritation. Always ensure the area is clean and dry to prevent infection. Step 5. Protect the blister. Cover the gauze with a larger piece of moleskin or duct tape to provide a cushion and prevent friction. If you don't have moleskin, use a bandage or any non-stick, non-adhesive material to reduce friction. The key is to keep the blister from rubbing against your shoe, which could lead to tearing and potential infection. Always ensure you have proper footwear and blister prevention supplies for long hikes, and seek medical attention if the blister worsens or shows signs of infection. If you can't treat a blister immediately, rest and keep your feet dry. Soak your feet in cool, clean water to reduce swelling. When you can, treat it as described. If you don't, the blister will grow and you'll be in more pain and at higher risk of infection. Always practice proper hygiene to prevent infections in the wild. Now, how do you know it worked? The blister should be clean, dry, and covered. There should be no redness, swelling, or pain. If the blister remains painful, red, swollen, or if you notice signs of infection like pus or fever, stop and reassess. If unsure, seek medical help. Remember, a blister is a warning. Treat it as such and you can keep walking. Ignore it and it can end your walk. This is how you treat a blister before it ends your walk. Clean the area around the blister gently with water or an alcohol wipe. Avoid popping the blister unless it's very large and painful, and then only do so carefully with a sterile needle and under sterile conditions. Once opened, cover it with a sterile bandage to prevent infection. Don't let your feet stop you, but always prioritize proper treatment and prevention to keep walking safely. Always verify plant and animal IDs with an expert, follow your local regulations, and never eat or use anything you can't 100% identify. First things first, prevention is key. Before your hike, make sure your boots fit well and your socks are moisture-wicking. Break in new shoes before you hit the trail to avoid friction and hot spots. If you notice any areas on your feet that feel irritated, stop and address them immediately. When you're out on the trail, regular checks are crucial. Take a few minutes every hour or so to inspect your feet. Look for any areas where your skin is turning red or feels hot. If you catch it early, you can prevent a blister from forming. Apply moleskin or blister pads to these areas right away to provide a protective barrier. Remember, treating blisters promptly can mean the difference between a comfortable hike and a painful, early end to your adventure. If you do get a blister, the first thing you need to do is clean it. Use an alcohol wipe or a sterile saline solution to clean the area around the blister. This is vital to prevent infection. Once it's clean, cover the blister with a sterile bandage or blister wrap to keep it protected and dry. Remember, if a blister breaks or becomes infected, seek professional medical help immediately. Here's a tip. If you're in the wilderness and don't have bandages, you can use a piece of duct tape or a clean, dry cloth. This makeshift bandage can help protect your blister and prevent infection until you can get to a proper medical treatment. Remember, it's important to avoid rubbing or further irritating the affected area. Now, let's talk about walking with a blister. It's tempting to remove the bandage and let it breathe, but this is a mistake. Keep the blister covered and dry at all times to prevent infection. If you need to, you can use a thick, cushioned insole or an extra pair of socks to reduce friction. Remember, always check local wildlife and plant regulations before venturing into unfamiliar areas to ensure you can handle any situation safely. Another important point is to keep your feet dry. Wet socks can lead to blisters more quickly than dry ones. Change your socks regularly, especially if you're sweating a lot. Bring an extra pair or two, and dry your feet out whenever you take a break. Always carry blister supplies like bandages or moleskin to protect any developing blisters. If you get a blister, don't pop it unless it's big and hurts. Use a sterilized needle and clean the area well if you do need to drain it. For large blisters, draining might be necessary. Use a sterilized needle or a sharp, clean object to puncture the blister at the edge. Let the fluid drain out, then clean the area thoroughly with an antiseptic solution. Apply an antibiotic ointment and cover it with a sterile bandage. This not only helps prevent infection, but also allows the blister to heal faster. Remember, proper care of your feet and blisters is crucial to avoid ending your walk prematurely. It's also crucial to know when to stop and seek help. If the blister is very painful, if you notice any signs of infection like pus or swelling, or if you feel feverish, you need to stop and take care of it. Don't try to push through the pain. Your body is telling you something is wrong, and ignoring it can lead to more serious complications. In the wilderness, you might not have access to medical care, so it's important to carry a basic first aid kit. Include items like bandages, antiseptic wipes, blister pads, and moleskin. Knowing how to use these tools can make a big difference in keeping your feet healthy and your hike on track. Remember, your feet are your lifeline in the wilderness. Take care of them and they'll take care of you. Don't let a blister become a bigger problem. Treat it early. Clean it gently, cover it with a sterile pad or bandage, and keep your feet dry and protected to prevent further irritation. Stay proactive with proper footwear, socks, and blister prevention techniques. This is how you keep your feet in top shape and keep walking safely. This is educational only. Foraging, hunting, and fishing carry real risks and are governed by local laws and seasons. Always verify plant and animal IDs with an expert. Follow your local regulations, and never eat anything you can't 100% identify. Carry a blister kit with you on every hike. It's not just about comfort, It's about survival. A small blister can turn into a debilitating sore if left untreated, leaving you immobile and vulnerable in the wild. Start by cleaning the blister with antiseptic wipes to prevent infection. If possible, gently wash the area with clean water and then dry it thoroughly. If the blister is large and painful, you might need to drain it. Use a sterilized needle to make a small hole at the edge of the blister. Gently press out the fluid, then cover the area with a sterile bandage or blister pad to protect it. Remember, always check local regulations and seasons for any outdoor activity to ensure you're prepared and legal. Proper foot care isn't just about the blister kit. Wear comfortable, well-fitting shoes and moisture-wicking socks to reduce friction and keep your feet dry. Tomorrow on the Survival Files, carry a load for miles without wrecking your back.